For the next presentation, we are very delighted to have Hu Yan to tell us about model development and cultural adaptation for evidence implementation. So, Professor Yan Hu is director of Fudan University Center of Evidence-based Nursing and Shanghai Evidence-based Nursing Center. Her area of study focuses on supportive cancer care, symptom management, and evidence implementation, which is a very important. Currently, she's leading her team developing an interventional program for musculoskeletal symptoms in breast cancer patients. Professor Hu Yan is also editorial board member of the Journal of Advanced Nursing and other peer-reviewed nursing journals. So the floor is yours.
Okay. It's my very great pleasure this time to visit Prague, the beautiful city, and also present my favorite part, implementation. I'm actually just as the introduction, I'm the nurse, and I belong to Fudan University Evidence-based Nursing Center, and it is one of the Center of Excellence of Joanna Bridge. So I'm very honored to present on behalf of one of the Center of Excellence of Joanna Bridge. And I'm coming from Shanghai. Here is some picture of very beautiful city of Shanghai. And I would like to invite everybody, if there is chance, we can host next meetings. Welcome to Shanghai. We try to, but because of COVID, we fail. But we will try next time. Okay. Actually, I'm going to address today is the cultural adaptation and model development of evidence implementation. Why I focus on that area? Like evidence-informed decision-making in healthcare is such a widely recognized in different places in the world in this century. And for China, it is one of the large developing country and embrace evidence-based healthcare for over 20 years. So it is very essential for us to contribute for global knowledge of evidence implementation and to explore what is the cultural relevant models and also how evidence from Western country can apply to Eastern world of the planet. So as we have already known, there are big gap in implementation. There are so many guidelines and systematic reviews produced by different scientists. But the implementation in the practice side, the implementation is another area. There are two gaps. One is from study to policy, and for policy to practice, the big gaps there. So there is, for nurse, I'm a nurse professional, so we need to carry out caring-oriented implementation. So to understand all these cultural-related social determinant of healthcare with cultural and context relevant. So how to effective and efficient conduct interventions in the different contexts. That one area we need to consider in a deliberative ways. So for us, we are one of the center of Joanna Bridge. So I think that model is very smart and very integrated model to consider global health as the goal of evidence-based healthcare, and also the key elements of scientific evidence and the context of implement the evidence and the clinic expertise in the in the situation, in the practice area, and also what is the preference of people. What is the preference of the people in the practice? So that's very key and very essential element for evidence-based healthcare. And also another, I think, very essential component for evidence-based practice in JBI model is FAME. F-A-M-E means when we implement the evidence into different cultural relevant contexts, have to consider deliberatively the feasibility and also the appropriateness and also the meaningfulness and also the effectiveness. That effectiveness is the one thing we consider, like a lot of people, is the priority. But in other ways, like social science, like nurse or psychology, we consider a lot in addition to effectiveness, like feasibility, appropriateness, and meaningfulness in implementation science point of view. So when we implement studies into practice, we consider a lot about the context. A lot of models, I think, we have learned for implementation, like this one, PARIHS model, developed by Professor Harvey and Kitson, the group. They develop a lot of knowledge to action models. And this one, the twins one, I think that's a very good conceptualized models to consider all these things in a very abstracted ways about the context, study context, and the intervention context. And based on that, in a Chinese culture, which is quite different from Western culture, like the decision-making approach and also the human workforce approach, everything are quite different from Western. We consider people in different levels of implement evidence into practice. So we develop our own models of evidence implementation, which we publish that models into in our journals. We call that Sunrise Model of Evidence Implementation, with the goal of continuing quality improvement to provide high quality of care and start with scientific evidence. But that is not the only things for implementation. We have to consider the underlying four elements, or in addition to the evidence, whether or not it is evidence informed, but also we have to consider the multidisciplinary teams or the professionals, the people who will implement that evidence. And also for the strategies of implementation, we think it is so essential to use a project management approach to make it like applicable and also goal-oriented. And another thing is continuing. The sustainability, it's one of the, I think that's one thing we have to overcome, how to make implementation sustainable. So sustainable means we have to consider it as a continuing quality improvement circle. So that is the key element for implementation in our consideration. And also based on that, the four elements, we divided all the implementation into different stages. Like we have to do the preparation, a very deliberately preparation to think about the context, to think about all people, the question, and also do a comprehensive evidence searching and critical appraise all this evidence, and to summarize in a easy understand by the practitioner and also by the patient ways, and do a comprehensive context analysis, and that's the preparation. So very long preparation stage. And in a second stage, we have to implement the evidence into the real-world practice, but that process is very challenging. We have to do the auditing criteria development based on scientific evidence, but scientific evidence is not equal to the audit criteria and also the protocol. We have to analyze all the barriers and also to conduct a change project, to have change management skills. And leadership, I think, during the whole process is such an important driving force to implement evidence into real-world practice, especially in healthcare area. And facilitations, that's another strategies let us overcome all these difficulties. So that's the implementation. That's a long process of implementation that go further and back and forth. And because it is implementation, it's a process, and it is also a science. So we consider the evaluation should be not only quality improvement, project, but also our research. Implementation research. We have to consider what is the scientific aspect of the implementation, what is the outcome we should measure in a quantitative way as well as qualitative way, what is the indicator or what is the element we have to assess. So the outcome assess is quite different in different levels of assessment in terms of system levels, practitioner levels, and patient level. So that's the third stage, but in addition to that, implementation have to keep into the real world step. So the final, the in-core, the very essential part is the continue, the sustainability and the maintenance stage. For that area, I think it is the most challenging part of implementation, how to make it sustainable and maintain the outcome. So that is one thing, I think, for us, we have to search in the solutions of sustainability. So everything for the evidence implementation make it quite challenging and quite a complicated stage. So we have some examples of evidence implementation, like this one is for prevention in a hospitalized aged patient. In that process, we have learned a lot of lessons, like leadership is a driving force during the whole process of for prevention evidence implementation. Without leadership, everything is impossible. And also a lot of the meetings or the negotiations within practice like stakeholders is such an important strategies to overcome the barriers and to develop some practical forms and instruments to let the evidence easy to understand and easy to carry out and easy to evaluate. So that's one thing we consider. So we have conducted some of the implementation project under Joanna Bridge clinic fellowship project, which is quite successful in the initial stage, but we consider what is the sustainability part. Like this graph, we see the compliance before compliance, the adherence to the quality indicators is quite low, like 32%, but after that it quickly improved to 93%. That's the very concurrent effect of improvement. But when we assess the sustainability of that implementation, we can see a lot of drop out after implementation. So for that, what is the barriers? What is barriers like the knowledge and the drive, the motivations or resources are the barriers, and strategies to overcome the barriers can be a lot of human-related activities, like a lot of education, like a lot of leadership strategies to motivate clinic staff or clinicians to keep their like motivations to implement the practice. But what we are concerned about, how to make it in a long-term sustainability. So that is always the questions, the difficulties for us. So we reflect on all these, like more than 50 evidence implementation projects. We reflect on that. Then we consider what evidence can be implemented in a specific culture, like in different country, can make it successful, and what kind of lesson we can learn from the process. So we conduct a grounded theories approach to explore the cultural relevant factors for that implementation. That is a grounded theory approach. We interview practitioners who conduct the implementation. We interview like the leaders who initiate the project, and also we observe and interview patient outcome. So that's the purposive sampling. We have interviewed 56 participants and conduct like unstructured in-depth interview and doing some codings on that study. And the findings, we have some like very interesting findings that the whole process of evidence implementation, like in a different culture, evidence from one culture and the implementation in a different culture, have to be considered as a continually circling with 5 very key elements. Driving force. What is the driving force for implement that sort of evidence, and the process of implementation, and what outcome we can see, especially from the practitioner point of view, what is the outcome they can see, and also from research point of view, what outcome for research can see, and also the sustainability. That is one thing. So after that, we have the very core variables from the grounded theory, which is taking road. Here is the model. Take the evidence. The driving force is from the leadership, and the driving force can be from external and internal requirement. And the approach of implementation, most of the approach is top-down approach. But we also see a lot of approach of implementation is bottom-up and outside-in. And that's bottom-up and outside-in are very successful than top-down approach. So the strategy is towards the patient-centered care, and towards nurse, and towards internal system, and some outside collaboration to make it happen. And the pattern is adaptive and transformational. And also the outcome is variable. It's not only the outcome only for patient, but also the outcome in terms of practitioner improvement and also the system improvement. But after that, right after the implementation, the outcome is so beautiful, but after that, it can be decreased or discontinued because of the resources, because of the driving force, lost the incentive. So that's the whole this process. So from that model, we can see if the implementation can be successful and sustainable, the leadership is like the engine to make it successful and sustainability. So lesson we learned is evidence should be reliable, updated, and informed practice, responsive. And the situation analysis is so important to precise, in-depth, and data-supported situational analysis. And for the implementation, should be cultural adapted, context tailored, and the process adjusted, and the technology innovative. And the facilitation is leadership and culture to fit the culture norm. So thank you very much for the presentation. Thank you.